coming up on Bronco Tales.
That was a little weird, just walking out with the guy's finger, putting it on the x-ray plate. But I'm like, he's still in the room. Yeah. So that was definitely probably one of the most interesting things.
In this episode, curiosity meets clarity, and the mysteries of radiologic technology are unraveled. We sat down with Kristie Hanson, a seasoned radiologic technologist, to address all of the questions you've ever had but were hesitant to ask. From demystifying imaging procedures to ensuring patient safety and discussing the latest technological advancements, we explore the world of radiology through the lens of an expert. Gain insights into the daily life of a radiologic technologist, understand the precautions taken to minimize radiation exposure, and learn about the various imaging procedures that play a crucial role in the healthcare. Whether you are considering a career in radiologic technology or simply seeking a better understanding of this vital field, this podcast promises an engaging and informative journey into the heart of radiologic technology. I'm your podcast host today, Anastasia Tracy. I am a radiologic technologist, but I'll be playing as though I am not an informed rad tech, so that we can hear from an expert who's worked in the field for a longer period of time than I have. So Kristie Hanson, could you please start by providing us a brief overview of your experience and background as a rad tech?
Yeah, absolutely. So I have been a rad tech for approximately 20 years. I did take school prereqs and some general education, and then the program is a 2-year process with interviews to get in. And then my background, I've been a rad tech in the hospital for 12 years, and then I was a supervisor for 9, and I'm still working in the field now as a rad tech. So yeah.
Yeah, awesome. Let's give a 30-second overview of what it is to be a rad tech, like day to day. What does the role look like for you in that as a rad tech?
Yeah, so day to day, we do a lot more than I think people realize we do. We do what's called fluoroscopy procedures. There's a wide variety of procedures. We can maybe get into that a little later. We do outpatient x-rays, we do surgery, we run the machines over there in OR, we run the emergency room, and then we go do portables on the floor to the patients that are in their rooms, collect history, and assist the radiologist, the physicians, and the PAs.
Awesome. It sounds like there are tons of different ways that you can spend your day. I mean, are you popping up to the ER on circumstances too?
Yeah, and so what I love about a day in a life of x-ray is every day is different. And so one day you might run up to the ER and do a couple. One day you might be in the OR for a little bit. So every day is totally different. Sometimes we do get assigned to certain positions in a day, but every day of the week is always different. So that's one thing I love. And we're always moving around and working with other departments throughout the hospital. So I really love that.
I love that too. The diversity really does bring some fun and excitement into your day, just being able to interact with different patients from different healthcare circumstances, be that the ER, be that the OR, be that, the ICU, you name it. X-ray techs are there, it sounds like.
Yeah, for sure.
I think one of the biggest misconceptions we should squash is a rad tech a nurse?
No, a rad tech is not a nurse. So a little different. And then we are, doing x-ray procedures. So sometimes a patient might come spend, 15 minutes to an hour if I'm doing a procedure on them. Otherwise, if I'm doing an x-ray, 5-10 minutes, and then they're going back up to their room. So we just interface with them when they're down there with us, and then they go back up to their room with the nurse. So we are the imaging part. We are not doing any of the, IVs or whatever, giving medications. But we do assist the nurses when need be in other departments.
Yeah, totally. I think there's a lot of interdisciplinary action that occurs, not just within medical imaging, but when you bring in some of the other things that even at Boise State we offer. So respiratory care, nursing, social work, public health, all of those things do play their role. It's just which part of the puzzle are we playing? And it sounds like rad tech is just a piece of that puzzle. Yep. In the same realm, relative to patient care, do you think that rad techs are doing a lot of the same things that nurses do? Like, are they coming up and, you said they weren't doing IVs, but what other ways are nurses a little bit different? So,
a nurse is going to be, taking care of the patient all day long up in the room with them. Yeah. Whereas when we're doing x-ray, we're coming up to them in the room, or they are coming down to radiology. We're doing their procedures, sending them back up. If their IV is going off, we might push the button to pause it, and then we have to call the nurse to come over. So I would say that's the biggest part, is they're caretaking the patient all day long. And then we are just a part of that care during the day with whatever imaging they have ordered. And then we just work with them to get the imaging done.
Awesome. Thank you for that clarification. Yeah. This might be a managerial level question, but what do you think about the salary relative to rad techs and nurses? Are they pretty similar?
Actually, I think they are really. So I think people have a misconception on, what a rad tech can make, and it's actually a really good salary. And then we get benefits along with that, with, paid vacation. And so just some really good benefits. And in the 20 years I've been a rad tech, I have always had a job. So it has been like a great career in that way of, it's a pretty secure job. And right now it's like there's tons of job openings. So that's great to know.
Absolutely. This is a little bit of a different realm relative to nursing, but I've heard of travel nursing a lot. Is there travel opportunity within the realm of medical imaging?
Yes, there is. They have locally been using some travelers, post-COVID. But yeah, you can travel in radiology and even in some of our specialty modalities, which we will get into that a little bit later.
Perfect. Let's jump to educational requirements. I know we've kind of been focusing on how we differ from nurses. Is there a different pathway that we become radiologic technologists based on the educational requirements?
The educational requirements, as far as I know, are pretty similar. We have to get prerequisites and some general education, 2 years worth, and then we do a 2-year degree, and then we get our bachelor's. So that's, I feel like the exact same schooling as a nurse, like the time frame in which you come out with. And then there's also opportunities to move on to get like your master's and whatnot.
Totally.
And other opportunities, yeah.
Is the coursework pretty challenging for rad techs?
You're talking about like during the program? Yeah. Yeah, it can be, but if you just, put yourself to it. And when I was going to school, I didn't really work the first year because I just wanted to focus on that. And the one thing about radiology is we do go into some different subjects that it's something that you've never learned before. So that's really interesting, and it's just awesome to be really focused on your classes and your grades. And then going into the, maybe the end of the first year and the second year, you can even start kind of working as a rad tech. They'll hire you, getting really good hands-on out in the clinical site. And so I really loved that about radiology.
Yeah, it sounds like a really great field because you're getting a job really before you graduate. My understanding of rad tech is that we are anatomy experts and we also have to do some physics. Of course, those are two challenging subjects. And like you mentioned, we are not, just born with that information native, right? We have to really buckle down and focus on that. And it sounded like you took a similar approach to me when I went through the program, and that the first year was really, head in the books. And then the second year I was able to kind of lighten my load, pick up some shifts and start working in the field. So it's a really great opportunity.
Yeah.
I'm going to jump to how the field is changing. How is technology involved in the field of radiologic sciences?
Oh boy, it is changing so much. When I first started being a rad tech 20 years ago, we still did film for radiographs, and we are completely digital now. So that has changed so much. Just a lot of advanced technology. And then also, we're pretty much paperless for the most part. So, we're doing our notes and everything and charging contrast and all that on the computers. So, yeah. And then the other awesome thing though, is it gets right over to the radiologist so they can see images, read them, and get those to the doctors to get the results in a timely manner for all those patients coming in needing to get those right away.
Totally. So always changing, that contributes again to that diversity in our day for sure, just being that it's a very technologically advanced field. You used a term that I do want to just jump into, radiologist. What is a radiologist versus a rad tech?
So a radiologist is actually the physician and the MD that do the procedures in radiology, and they read all the exams. So they are actually a physician. So yeah, people sometimes get those terms crisscrossed, but yeah, rad tech has a bachelor's in science. We assist them do the radiographs, but they are actually the physician that is, reading the exams and giving the results to other physicians, and they do procedures in all the different departments. So
perfect.
yeah.
I think while we're squashing misconceptions and misused terms, let's talk about radiation safety. Obviously, we're in a field where we're being exposed to radiation. So what do you do to prevent, glowing in the dark?
Yeah, so that is a huge part of our education. And I think that's something also people don't realize. Like, it's a pretty big section of our education. And so we are taught how to, distance ourselves, time, and shield. And we also wear radiation dose badges. We are also allowed more radiation than the general public. But there is a lot to radiation safety, and we are trained in that. And so that's what we're experts in. And so that we can make sure that we're keeping ourselves safe, the general public when they're coming in for their images. And that's what we do to help our patients.
Perfect. I know when I've gotten an x-ray in the past, they've used shielding, but it sounds like shielding requirements have changed a little bit in recent years too. So are we still using lead shields as rad techs, or are we only doing that for patients these days, or what's the scoop with shielding?
So we are using some shielding for rad techs when we're under live x-ray, because we are in the field all day, every day. But like general x-rays and whatnot, we're really not shielding anymore. Their studies are saying, we just don't really need to. The amount of imaging is, radiation is so low that we're not really needing to shield. There might be a few procedures that we might have to, abdomen or whatever, but other than that, we're not really required to do that anymore. So that's kind of been a change to, when you're in the hospital, to kind of change that mindset that it's safe to not shield on everything.
Yeah, and I think that's exactly what I wanted to hit the nail on the head for there, is that, we have this conception that radiation is super dangerous and we're all going to die of cancer and blah, blah, blah when it comes to exposure to radiation. But it really sounds like tech has contributed to our ability to lower the radiation dose that, us as rad techs are exposed to every day, but also our patients they're exposed to when they come in for these specific procedures.
Yeah.
What does it look like for you relative to education after you've graduated? Do you sit for a boards exam? Do you have to maintain continuing education credits? Tell me a little bit about that.
Yeah. So after you get done with radiology school, you do sit for your boards. Once you have taken your boards, then you just continue working. Usually if, before you take your boards, they'll have you work as like student tech. So there's different classifications. So then the pay will change and then you'll get your credentials. And then after that, we are required to have 24 continuing education credits every 2 years that we have to keep up on.
Perfect. Which agency are we accrediting through? Like, how do we prove our competency?
ARRT.
Perfect.
And then ASRT is who we can get our continuing education through.
Perfect. Is the boards exam difficult?
I feel like once you've went through the schooling, you are very, very prepared. And I didn't feel like it was terrible. You just have to go through school, know all your stuff, and they just have a little bit of everything from what you learned in 2 years. And so, 4 years, I guess. But yeah, you are so prepared that you will know everything on your boards. And I'm pretty sure the pass rate is very, very high.
I think it's like a 70 right now, but I would need to double check. But yeah, you're right. That's 3/4 of people who sit for it at that point, right?
Yeah.
It sounds like with the 2-year time frame that we're in school, there's also a lot of clinical hours. So we're in the hospitals and doing a lot of hands-on work. So I'm sure that contributes to your ability to be successful on these boards, because it's not just application of your knowledge of radiation physics and your knowledge of the anatomy that we are the experts in. It's also applying what you've been practicing every day in the career field. I'm going to just jump to you as a rad tech and your career as a rad tech. What is the most fulfilling part of being a rad tech? Like, what drew you into the field? What kept you working in the field for this many years?
I think I love helping people. And, people are sick and they have a lot of different things. And we play such a huge role in being there to comfort them and diagnose what's going on. And so I just love the patient care interaction. And it's just so rewarding at the end of the day that that's what I absolutely love about my job. And I love just the variety of my job and the people that I work with and the radiologist and all my other coworkers. Like, it has just been like the best field ever. Mm-hmm. And after 20 years, I still absolutely love it.
It's amazing. I think that those are the type of people you want working on your healthcare team. And then to also hear that you have such strong collaborative efforts with your teammates, like they become your family at that point. And so it's really important that you're maintaining those relationships positively.
Absolutely.
This is going to be a curveball question for you, but what's the weirdest thing you've encountered in your day? Like, what's been the coolest kind of trauma case or maybe surgical case that you got to be a part of?
Oh, actually, so I had to go to the emergency room. This was when I worked still in Montana, but there was this guy that came in and he actually got his finger caught in an auger. So it got completely, cut off. So when I went in the room, I had to take his finger with me outside of the room and take an x-ray of the portable with it. And so that was a little weird, the part disconnected. Oh my gosh. And the guys were kind of joking. They're like, hey, don't lose that. Because I think when it goes in, it flew out. And so it took them a while to find it. And then they bring it to the hospital because then they have to see if they're able to reattach it due to if there's a lot of, vessels or whatever severed. But that was a little weird, just walking out with the guy's finger, putting it on the x-ray plate. But I'm like, he's still in the room. Yeah. So that was definitely probably one of the most interesting things.
It's like, hey, I'm going to borrow that real quick. I'll be right back.
Yeah. So that was a little weird. Here, I'm just going to take your finger, get a little x-ray.
Keep it safe.
Yeah. So it was disconnected part and you have it with you and the person's not with you.
Oh, wow.
Yeah. So that was very interesting for sure. That was just, one of the many, but that one really sticks out to me.
I think that story also highlights that, people get into rad tech and they think that they're not dealing with blood, guts, gore, those sorts of things. And there's proof that, you probably will.
Oh, yeah, for sure.
Wow. Well, I think we got a lot of great information from you relative to the career of a rad tech. What opportunities are there for advancement in the field?
Oh my gosh. So for advancement, there are so many different branches you can go into, which I totally love. So first of all, if you're in radiology, you can go into management. You could be a sales rep for the equipment people. And then you can also go into ultrasound DMS. You can also go into MRI. You can go into cath lab. You can go into interventional radiology and CAT scan. Did I miss any, Anastasia?
I think you hit all of those that we offer, at least at Boise State. I know there's some opportunities that are not offered at Boise State, such as nuclear medicine.
Oh, yeah, I forgot nuclear medicine, but yeah.
But yeah, we've got, now I'm going to just, shameless plug for Boise State medical imaging opportunities. So, of course, we have our rad tech program. Once you've completed the rad tech program, you become eligible for our CT program or our interventional radiology program. If you don't want to go through our rad tech program, but you still want to work in the field of medical imaging, we have our diagnostic medical sonography program where you're able to sit for your abdominal and OBGYN or obstetric and gynecologic examinations. And you can also take the primary pathway of the MRI route, which is magnetic resonance imaging, which is a specialty for, musculoskeletal purposes. And then we also have our interventional cardiology route for people who don't necessarily want to go through radiology first, but they want to work in the field of medical imaging as well. So we do have tons of opportunities at Boise State. These are all bachelor's degrees programs. So, shameless plug there. Please reach out to your program advisors. You can always reach out to me, Anastasia Tracy, relative to ultrasound, and you can reach out to Kristie Hanson, and she can connect you with anybody in these departments. So are there any final words that you want to offer us, Kristie?
Not that I can think of, but yeah, so this was great.
Yeah, super fun. Thank you for coming and joining us. And we'll be sure and link our program's website in the podcast description so that you can find us to connect with us with more information about the field of radiology.
Thank you for listening to Bronco Tales with the College of Health Sciences. Join us next time as we discuss how Boise State School of Population and Public Health students and faculty are using upstream prevention models to better assess youth mental health needs across the state.
When we do our yearly surveys, it's really interesting to see the differences in the data of each school community. And we survey on a wide array of things, such as school safety, having a trusted adult, substance use, community factors, more individual factors as well. And it's really interesting to see how different each community is from each other.